Hello, everyone. My name is Deb Sprague with Medical Advantage on the sales and marketing team, and I am excited to be sharing with you today an introduction of Medical Advantage ACO, the Accountable Care Organization. We are going to provide a fantastic overview of what Medical Advantage is able to provide to you as an accountable care organization, otherwise known as ACO. You'll hear us mention that quite a bit. I'm excited to be joined here today with Diana. We'll do a quick introduction for her, but just a little bit of housekeeping. This is a pre-recorded webinar if you found us on our website, but however, we are able to take questions. So on the side bar, you'll see a little bubble. Feel free to enter any questions and we will respond to you really quick just to be able to get those questions answered. So feel free to enter in any questions in the bubble, and this also will share with you another way to reach out to us with more questions or if you want some more details. Diana, thank you so much for joining us today. I'm really excited to have you here. Your wealth of knowledge around accountable care organizations and the experience that you bring to Medical Advantage is greatly appreciated. Would you be able to introduce yourself quickly?
Yeah, thanks, Deb. I've been with Medical Advantage Group for a number of years now and in a variety of capacities. I spent a number of years in practices supporting the advancement of risk-bearing contracts and performance improvement, along with supporting physician organizations and ACOs on the administrative end. So there's a lot of advantages in participating in an organization like this, and I look forward to talking about it further.
Fantastic. Thank you so much, Diana. I really appreciate your time today and sharing with us more about it. But first, let's do a little bit of what we're going to be kind of sharing and going over. The background of an ACO, of course, an overview of our Medical Advantage, why Medical Advantage is launching an ACO and what we are able to help and differentiate. We're excited to share that. How we are supporting our practices within the ACOs, and of course, why you should join an ACO, and of course, how to be able to enroll to get you some more details. So let's dive in. Quick overview about Medical Advantage. We are a part of the Doctors Company. This is a longstanding organization, of course, the nation's largest physician-owned malpractice insurer. Our job at Medical Advantage is to really support the physicians that we serve. We are a mission-based organization, of course, and really are consistent in providing all multiple of supportive ways to our physicians. We know it's confusing. There's so much that's out there right now, and all of you seem are overloaded. And our job is to really simplify that and support the practices to be successful. We know that ACOs are extremely confusing, and that's why we're here today. Our job is to really simplify and relieve the burden for all of you. So we're excited to dive into what an ACO is. So Diana, could you share with me a little bit more about what is an accountable care organization? Let's just simplify it right out the bat.
Yeah, thanks, Deb. So just to give a baseline, the Medicare Shared Savings Program Accountable Care Organization is a CMS program that promotes accountability for a population of Medicare fee-for-service beneficiaries. And the goal is really to improve the coordination of those fee-for-service services and encourage an investment in infrastructure and redesign care processes for high quality and efficient service delivery, and ultimately in promoting better value care. So under the shared savings program, when providers participate in an ACO, they continue to receive the traditional fee-for-service payments under Parts A and B, but with their participation in the ACO, there's the opportunity to share savings and additional surplus.
Awesome, fantastic, great overview about that. So why is Medical Advantage starting an ACO, and of course, what would be the advantage of participating with the Medical Advantage ACO?
So Medical Advantage has a mission to simplify the delivery of efficient, high quality healthcare, which really lines up perfectly with the goals of a CMS accountable care organization. And with that, we have experience in this area as well. So this is really familiar territory for us. Medical Advantage has been supporting ACOs for a very long time, both administratively and advancing quality, supporting providers, providing detailed analytics, and in a consulting capacity for ACOs as well. So it made sense for us to continue in development of a 2022 ACO and offer the opportunity for providers to participate.
What is the scope that Medical Advantage will be providing within their ACO? What's the coverage?
Yeah, so initially we're looking to begin in Ohio and Michigan. We do hope that providers express interest, and we would be open to expanding beyond that, but initially those two regional areas.
Fantastic. I know we're going to talk a little bit further, of course, our knowing and our dedication to the primary care physicians and the specialty physicians. We are dedicated to that. That's something that is not unique with Medical Advantage, and we're really focusing on that. We'll do a deeper dive into that practice transformation, of course, but can you share with us the Performer partnership and what we have been able to do with our partners?
Yeah, and I do get into a little more detail here as well on that partnership. But what we're looking to do is find providers and practices that are committed to being engaged in the process with us. That's really the most important thing. We look for providers who are engaged partners with us, and we've set up our model in a way that we think reflects that.
Awesome, fantastic. Well, let's dive into that practice transformation piece, and we'll dive into that a little bit later. But of course, some of the nuts and bolts around of the ACO. Could you? I know we're really excited because this is a zero cost for the provider. Can you share a little bit more?
Yeah, I think this is really one big differentiator for us off the bat, is that there's no participation fee, there's no PMPM fees. And we do plan to start in a level 1 track B ACO, which is upside only potential. However, the program is modeled in a way that we will have to take on risk in the ACO at some point, and Medical Advantage is committed to covering that downside risk for providers. So really for providers, it's upside only for the long run, because Medical Advantage will be covering the risk.
Fantastic, a really good overview. So zero cost, zero risk for the provider, because we'll be taking that on. And then of course we work and really help you within the maximizing those earnings, and we'll be sharing that and diving into that a little bit more. Fantastic.
Yep.
Thank you.
Our goal, sorry, I was just going to add that our goal too in the shared savings piece is to have a 50-50 split. So as I just mentioned,
Perfect.
in that partnership and performance, we see the opportunity being a 50-50 split on any surplus sharing potential that we may earn.
That's fantastic.
Yep. And we've been working, like I said, in this space for a very long time. And so we're really experienced in the principles of cost and quality and risk and activating the change we need to see inside of practices. And we do that through EHR integration, billing and coding training, educational seminars, performance reporting, and that list you see there. So there's a lot of other things, but those are some of the key transformation principles that we apply.
So this isn't a new space for us. We have been providing this type of back-end support for other ACOs. We're just excited to be launching off our own Medical Advantage ACO, and really excited to dive into it and partner with physicians and become that trusted partner.
Yeah, and one last thing I wanted to mention, Deb, before we move into the next slide, is are the MIPS benefits to participating in an ACO. Even at the level B track, quality will be reported at an ACO level. And what we've seen is that providers who report at the group level in an entity like this tend to perform better than reporting at the individual level, which also helps reduce the burden because they don't have to report individually. And as we advance into a risk-bearing track, we will move into an advanced APM model where providers can receive that 5% annual bonus on Part B payments. So on top of the benefits of simply
Mm-hmm.
participating in the ACO, there are some MIPS and advanced APM benefits that also apply to participation.
Fantastic. Thank you so much. Anything else that you want to highlight within our overview?
No, I think we can move on to the support.
Awesome. So this is where Medical Advantage has its deepest expertise, and of course, proven success is how we are able to partner with our practices. This is where we'll probably spend the majority of our time, of course, sharing how we are able to do that. Could you take us through the steps of what we do with each practice?
Yeah, so this always looks very simple and easy when we try to squish everything into one slide. But our approach, as you can see, is very iterative and cyclical. Initially engaged practices is our key requirement, and that's really the main point of participation with us. So since we aren't asking for any financial participation and we aren't taking PMPM funds, we really ask that practices come in fully engaged and committed to the process, which means that they're active and participating with our practice transformation staff and other staff that will be there supporting them. Because without a provider champion and staff engagement, the support we offer really doesn't take hold in the same way. So our main step that we launch into is that we start with some data and we put a really smart team of people in front of it to analyze it and find where there's not only opportunities, but opportunities that are actionable for each practice. We use data-driven analytics to find solvable problems and solvable problems that are specific to the practice. So we don't come in and say, you know, here are the top 5 problems within the ACO, go work on these, because they might not be the same top 5 problems for every practice. And so we really drill down and dive deep, specific to each practice. And really initially going into an office or speaking with an office, we need to take time to first learn how that practice works and assess their workflow. Understanding the roles of different people in the practice, the technology at mix, how their patients are finding their way into and back into the office. And once we have that basic understanding, we're going to ask questions to understand how it works. And that will all help us then apply the analytics and apply redesign support and this understanding, you know, the different things at work, the sophistications of their staff, the challenges they have, and we'll do that for each and every practice to really help get an idea of where we're at and zoom in and out on the opportunities at play.
Fantastic.
Yep. So we understand, you know, the measures that show opportunity. We'll develop an action plan, like I said, that's specific to that practice to help improvement. And so ultimately, this is a lot different than a typical approach where you'll see, or where reports will just get dropped off, right? Because the office is busy, the receiver of the reports is busy. And if we come in and say, here are 5 reports you need to look at, decipher, and take action on, they're going to end up on a desk, right? Because everybody's busy and everybody's got work to do seeing and treating patients. So our role is really to help break that down a little further and even be an extension of the office as we help work to advance the care that we're doing within the ACO model.
Fantastic. So you're able to really help and then design an intervention to be able to really design an intervention that is customizable, really based on where those issues and concerns are for that individual practice. So very specific, detailed interventions and plans. And then we're able to continuously evolve and look at how they're improving.
You're absolutely right with that, Deb. So we have a set of interventions, and we deploy those interventions in a very public health type of approach. So we have a problem, we have an intervention, we deploy a team to help those, implement those interventions and monitor them. to see if it works. And we're going to work with a practice hands-on to do that. Now, that doesn't mean with all of these interventions and working and reports that we're going to move into a practice, right? Because as I said, they have work to do seeing patients. But we're gonna listen. We're gonna do good pre-work, leave good homework, follow up on the phone and email, and not spend all day with the practice, right? It's very intentional on how we work and iterate through the process.
Fantastic. But as you said, it does take an engaged practice who's ready and wanting to participate and partner with us and to make it better. Of course, that's the secret sauce in a way.
Yeah.
So
Absolutely,
is definitely that partnership. So I'm going to move on and dive into, like, what is it when you're coming in one practice at a time? It could be, for one practice, it could be this, and another one, it could be this. Let's drill into what are some of those focuses and areas that you're able to help a practice with.
Yeah, so that's exactly it. And as I mentioned, we focus on the details of the practice and how that aligns to the requirements of the ACO. So we believe in relentless incrementalism, and we work to guide practices through that change. If we tell practices we have 20 problems to fix, we might not be invited back.
Right.
So we'll focus on 5 things, and one practice might have advanced care planning to work on, where you're talking with patients about the healthcare they want to receive in a medical crisis, or transitions of care might be the topic or the metric we're working on, or it could be a diabetic measure that's low, and we'll talk through that diabetic retinal eye exam, why those scores might look low, track the process, the progress, look at the data, and continue to help advance. And so all of these are different things that help us generate the support in advancing the success of the ACO.
Can you talk a little bit about on the billing and coding, because that's also another process. You did a great job, kind of that population health management and those pieces, but there's also the rev cycle management and the back end. There's a lot of opportunities there.
Yeah. Yep, absolutely. So a big piece of the accountable care organizations is focusing on the HCCs. And so focusing on risk and capturing the complete accurate patient risk is really important. And we do have offer analytics that support that and help guide practices through that. But also in that piece, we offer billing and coding support. So we have certified billers and coders on staff who will offer educational sessions for our ACO. And if we need to, we ping their expertise on a specific concern or issue and pull them in and use those different levers of people and expertise to continue to drive and advance what we're working on.
That's fantastic. And I think, going back to why Medical Advantage, and is always a differentiator that I always see, is the people that we have. Yeah. These people that these consultants and members that will work with your staff are experienced in practices themselves, and have been in the shoes of many of our practices where they're at the moment. So fantastically trained staff and team members to partner with you within the practice.
Yeah.
So I know that there are some fantastic reports that we are able to provide, those performance reports and little one-on-one pieces. You provided 3 different examples that we're going to show. The first one is a patient priority list, is just an example. Can you share a little bit more about the types of reports that we'll provide?
Yeah, so we have 3 blinded sample reports here. And the first one we're looking at is a list of patients for a sample practice. You'll see high risk score patients listed in here. And it shows you the risk score from last year and the risk score from this year, as well as the cost from last year and the cost from this year. To the right, you'll see further columns that show categories of conditions. And so what this does is it helps us understand that, if you coded a condition last year, maybe they're not all coded this year, or, what the cost looked like last year is different from this year. And so it helps us at a high level identify what we might want to drill into and look at further for things that are either a flag or that we want to just acknowledge that may need to still be completed.
Awesome. I'm going to move on then to the next one is more of a patient, the CMS HCC patient detail. Can you share what the difference is between this report?
Yep, so this one focuses more on the HCCs themselves and the number that were completed year over year. So one example I think that's used quite regularly is if you have an amputee patient last year, that amputee still needs to get coded the same this year. The coding does not carry over. So you want to make sure that that's happening regularly, and this report can help identify, as you can see in that first row, the provider had, for that patient had 10 HCCs last year, and this year it's 4 so far. So why is that, and what needs to be done to make sure we're capturing, or the practice is capturing that accurately?
All right. We're going to transition then into by the practice, by utilization by the facility. Can you share a little bit about, Diana, about this one?
Yeah. So this one, as you said, it is more facility focused, but what it'll end up showing is that, you can see cost associated here, the number of members and the number of encounters. So though a facility cost might be higher than another, that doesn't necessarily mean it's wrong or bad. But what it can show us is that if one facility saw 20 patients and it was $1 million, but another facility saw 20 similar patients and it was $250,000, why is that? Is it worth looking into and having discussions with those facilities? Are they truly a lower cost facility, or maybe one is a learning hospital or a teaching hospital? There are certainly reasons for that, but again, this helps us identify potential opportunities that are worth looking into further.
Fantastic examples of reports that we are able to provide to our ACO members. So that's awesome. So of course, Diana, if somebody is interested in joining, if they want to learn a little bit more about the Medical Advantage ACO, here's your contact information, of course, but also can you share a little bit more on our website?
Yeah, so as you said, feel free to reach out to me directly. I'm happy to have a conversation, but also at medicaladvantage.com/ACO, we do have a form you can fill out to be contacted, as well as find other information that might not have been covered here today, and find out more about the opportunity of participating in our ACO.
Awesome, fantastic. Well, thank you so much, Diana, for joining. Feel free to, we're always looking for more information. Follow us on LinkedIn. We have a podcast and also on Facebook. Our resources and insight pages, of course, have a chance to learn more. Thank you again, Diana, for joining us and sharing a little bit more about the Medical Advantage ACO. Feel free at the end of this session, there is a survey to take. We could be able to contact you right afterwards, so feel free to fill that out. And of course, we'll answer any questions that you may have or want to learn more about the ACO. Thank you so much, Diana, for joining us.
Thanks, Deb.